Hey everyone, my name is Tony Smith, and this is my final project for HCA 415, Community and Public Health. The role of community and public health and well-being of populations, description of public health organizational structure, legal and ethical dimensions of public and community health services, analysis of funding of public and community health services, and the role of communication and community and public health programs will be what I will be discussing in the screencast. My thesis. Community and public health is important in maintaining the health and well-being of the public and community. At the federal, state, local, and tribal levels, public health maintains proper legal and ethical operations to uphold the trust of the public and communities. Through disease prevention, improving health statuses, health promotion, and community engagement, public health is making a positive difference in the lives of the whole population. The role of community and public health and well-being of populations is to protect the public from naturally occurring public health threats, to improve public health responses to chronic disease threats and other serious health threats, to improve health and well-being of communities, and to increase community awareness of health threats and healthy lifestyles. Also to observe health statuses of community, to recognize and resolve health problems, identify and examine health concerns and risks to the community, notify and inform population of potential health problems and catastrophes, and activate groups into action to resolve health issues. Also to establish policies and procedures that help to maintain community health efforts. The public health organizational structure. The federal government is involved in public health policy making, protection, financing, collection, and dissemination of health information, capacity building for population health, and direct management of public health services. Structure is complex and made up of networks between public and private sectors to promote and protect the public's health. Federal, state, local, tribal, and non-governmental agencies have the authority, while centralized and non-centralized control the delivery of services. Department of Health and Human Services is responsible for these activities. It works together with Center for Disease Control and Prevention, Health Resources and Services Administration, Food and Drug Administration, National Institute of Health, Agency for Healthcare Research and Quality, and Department of Homeland Security. Legal and ethical dimensions of public and community health services. Burnham notes ethical and legal issues in community and public health services as ethical issues in data collection and use, resource allocation and settings of priorities, political influence and intergovernmental relationships. Public health practice is governed by federal, state, and local law. The public health practitioners need ethics training and support on public health issues. The main focus is on health information privacy and healthcare accessibility. Privacy in public health has led to the passing of the HIPAA, Health Insurance Information Privacy Act. The government has passed the Affordable Care Act, or the ACA, to make health care affordable to all Americans. Funding of public and community health services. Public health services are funded by U.S. government through 8 public health agencies. Funding is dependent on the community. Funded through community, government, or nonprofit organizations. Some sources of funding are private insurance, ACA, Medicare, Medicaid, and WIC. These include Agency for Healthcare Research and Quality, Center for Disease Control and Prevention, Agency for Toxic Substance and Disease Registry, Food and Drug Administration, among others. Additional funding comes through collection from third-party payers and user fees. The role of communication in community and public health programs. Communication has relevance in every aspect of community, public health, and well-being. It helps to influence health choices and health literacy across populations and communities. It increases public knowledge and awareness of health issues and healthy lifestyles. It demonstrates advantages of behavior change to public health outcomes and enhances support for health services. It helps in disease prevention and health promotion. It helps people to exchange information and address issues facing communities. It combines theory and practice to understand messages and change human behavior concerning health. In conclusion, community and public health has the responsibility of preventing epidemics, communicating to the public, responding to disasters, and protecting the public against environmental harm. The organizational structure is complex and branches out into different sectors. The funding of public and community health can come from many different sources, and there can be both positive and negative outcomes when it comes to funding. Communication is the key to potential funding sources, but the public needs to be the main receiver of communication in order to educate, empower, and create awareness.